I'm Mike Dilks and I'm an ENT surgeon, ear, nose and throat surgeon at Health Hub in London. When I talk about laser for mole removal, people initially think I'm going to say we use the laser as a knife to cut the mole out and then to sew it up or glue it up or whatever. Yes, the laser can be used for that if you've got a cancer you want to remove with a nice clean margin, but actually most laser of moles is not for cancer. It's just for the mole that's been there for 10 years, it's a bit unsightly, it's usually on the face, it hasn't changed colour, hasn't grown, hasn't become itchy. These moles don't need to be removed surgically, they can just be vaporised or flattened. That's what I do with the laser. If you cut a mole out, then you're left with a scar line and often stitch marks. If we're talking about the tip of the nose or the cheek or anywhere in the middle third of the face, then any mark or scar or stitch mark is going to be quite obvious. So in particular, I'm keen to use lasers to flatten moles in these areas, but also because of the speed of it and the user-friendly nature of the treatment, I'll treat moles down into the neck and even on the shoulders as well. Laser vaporization of moles is done under local anaesthetic, almost always. When there are lots of them, you do it under general anaesthetic. So you inject a little bit of local anaesthetic into the bottom of the mole. So after 30 to 60 seconds, the mole is numb. So the laser arm is brought over, the suction's turned on, the laser is then switched on and the mole is vaporized down until it's flat with the surface of the skin. You can't feel it anymore when you run your finger over the mole. You can't see it anymore when you look at it. And that means you've gone deep enough. You give it a bit of a clean up, then I put a little bit of Vaseline over the area where the mole was. And this has to be changed every 4 hours for about 2 days, for about 48 hours. After this time, there'll be a little pink patch which will fade away after about 2 weeks. Sometimes I do see patients who come to me for laser mole removal and I'm worried about their mole. They're people who may have been exposed to a lot of sun, they may have ulceration of the mole, and these people need to be properly assessed by an oncological dermatologist. Having said that, the majority of people, I'd say 99% plus, do not have these features. They have benign, long-standing moles which are suitable for laser vaporization.